Good evening, everyone. I am David Mandel from OHEL Children's Home and Family Services, and welcome to a conversation this evening on the long haul, the impact of COVID recovery on the whole family. Since the pandemic began, OHEL has provided a platform called TheraZoom on a variety and an array of issues related to COVID, the pandemic. We've had conversations with tens of thousands of people throughout New York, the metropolitan area, the country, and the world over. Many of these sessions have been led by Dr. N Blumenthal, the ZACTA chair of trauma at OHEL. Tonight's conversation is a bit different from all the other conversations we've had in the last 8 months with all of you listening on this call and so many others. We're going to be joined this evening by Adina Lewis Garbuz, who will give a personal perspective on, as the wife and the family of the first person diagnosed with COVID in New York and in the country. OHEL would like to thank the UJA for co-sponsoring this evening's conversation, Sivi Ryder, Director of Children's Services at OHEL, Cheryl Charnovsky, Tammy Kornfeld, and Shana Blisco for arranging for this evening's conversation. OHEL provides many services to schools to support teachers, parents, and families during this difficult time. And in fact, a workbook is shortly coming out on resilience to COVID that Sivi Ryder, David Leiptag, and their staff have worked on assiduously these past months. For more information on any of OHEL services, please call OHEL Access at 1-800-603-OHEL, 1-800-603-OHEL. For those of you that are calling in, please mute yourself as we can hear background noise. We invite everyone to ask your questions as the conversation goes along, first by Adina Lewis Garbuz, followed by Dr. Blumenthal, and we will respond to as many questions as we can this evening. At Adina Lewis Garbuz's request, we are very specifically asking, although this is on Zoom and it's a public forum, if there are any journalists or media joining us for this presentation, we are asking you not to publicize any of the information, to respectfully respect the wishes of the presenters, and not to publicize any information that's discussed this evening without the explicit permission of Ms. Adina Garbuz or at OHEL. Please respect this very important item. I met Adina Lewis Garbuz and her husband recently, and I have no doubt that what I heard that evening was only a small part of what you're going to be hearing shortly. Adina Lewis Garbuz is a mother and wife who is also a partner at the boutique trust and estates law firm, Lewis and Garbuz, which she founded with her husband, Lawrence, 20 years ago. When Adina is not working, she's involved with many charitable causes, including most recently, serving on the executive board of the Angusel of New Rochelle, board member of the Bed-In of America, as a member of the liaison committee of SAR High School, as well as being involved in many other Jewish charitable organizations. Most notably, in Adina's work realm, she and a firm work closely with OHEL's Lifetime Care Foundation, an umbrella under OHEL to assist families with members who have special needs and special needs trusts. Outside of this, Adina is committed to many causes and her community, especially to support Klal Yisrael and a great passion for the land of Eretz Yisrael. Before the pandemic, her house was always filled with guests, and she spent much of her time preparing grand meals for her children and her many guests, including baking a favorite activity. Nowadays, finding time to do things, she has much less time than before. She enjoys nature, taking long daily walks with her husband Lawrence or friends, something she considers one of the highlights that helps her find the good in these trying times. Ladies and gentlemen, it's my pleasure to introduce Adina Lewis Garbuz.
Thank you, David. Can you all hear me?
Yes.
Okay. Thank you, David. Thank you, OHEL. Good evening. Thank you all for joining in this program. As you know, my name is Adina Garbuz. I'm a mother of 4 children, a daughter who is 23, a son who is 21, a son who is 19, and a daughter who is 15. I'm the wife of Lawrence Garbuz, known to so many of you who supported us by praying and davening on his behalf as Eliezer Yitzchak ben Shifra. I'm not a therapist or in any way a professional in the field of mental health, so I speak to you only as someone who, like many of you, have gone through the ordeal of COVID. I'm sure many of you have suffered terribly from the loss of ones close to you, and hopefully some of you have been as lucky as me to have seen someone close to you who had become very ill recover. I'm sharing our story with you to firstly give back, as so many of you were so supportive of me and my family in a terrible time in our lives. Secondly, while my story may have unique aspects to it and it was traumatic in its own way, it is like what many of you have been going through for many months. I don't, and I'm not sure anyone can provide answers or solutions to what many are going through, but knowing that you're not alone in those feelings, knowing that we are all going through this together, I believe can help us all get through this trying time. At that time where no one could really do anything for us, I and my family all agree that the fact that we received supportive words from others made all the difference for us. This is why when people ask me what they can do for someone, I say, just reach out and say, I'm thinking of you. You don't need to say anything more than that. Our COVID story began in the last week of February. My oldest daughter, Ella, had just moved to Israel in early January, and my son, Jonah, was in yeshiva in Israel. I went to Israel on Motzei Shabbos, Saturday night, for 5 days to get an apartment ready for my daughter. Not wanting to leave my husband and my youngest home alone for Shabbos, I was to fly back on Friday morning. When my other son, Liav, and my husband took me to the airport, my husband, Lawrence, wasn't feeling great, but he wasn't actually sick either. He felt very run down and had a bit of a cough. While I was in Israel, he started to feel worse and then started with a fever a day or 2 later. So he stayed home from work, something very unusual for him. He usually works very long hours. By Thursday, when I spoke to him, he sounded literally breathless on the phone. I remember saying to him, you call your doctor now to get seen, or I'm calling from Israel, but you must go to a doctor. I called my 15-year-old Eva, who was the only one home, and told her she had to skip school and go with her father to the doctor by Uber. In the end, I texted a friend who took them to the doctor. Upon listening to his lungs, the doctor sent him straight to the ER to be admitted. His lungs sounded bad. His doctor was worried and suggested he wear a mask, that he could be contagious. Meanwhile, I called Liav, who studies at Yeshiva University and was in class. I told him that Daddy is in the ER and that Eva is with him. She's too young to be there alone, and he should meet them there. And in the emergency room, they wavered between wearing masks and not to. I just recently saw a picture of my two kids taking a picture with masks on, and you could see that they're smiling as they thought it was like the craziest thing, something so unfamiliar to any of us. Try to remember back to February. We didn't know of masks or even the term COVID-19. We had only heard of coronavirus far off in China. Lawrence was admitted to a local hospital and soon thereafter moved to the ICU. He needed oxygen, but we thought he had a typical pneumonia. I arrived at 5:30 a.m. or so on Friday morning. I dropped off my things and went straight to the hospital. By 8 a.m., I was by his side and he was okay. I thought this was a minor inconvenience. He would get medication and he would be home soon enough. I was glad he was in a hospital only 5 miles away so we could walk over on Shabbos, and I was going to stay with him, but he insisted and I agreed that I had been away all week and my children should not be alone. So I planned to walk over early Shabbos morning to the hospital. Just for some context, I had not slept since I had gone to Israel, since I had such a short time to get things in order there. I flew through the night and went straight to the hospital. We ate Friday night dinner, and as usual for my family, my kids jumped into my bed to hang out with me. I was asleep by 8 for about 20 minutes when the phone rang. It was my husband. He said, "I cannot breathe. He needs help." I threw some things into my coat pockets and drove fast to the hospital. When I got there, they had just ripped his shirt open to do something. I don't know what. By then he had a fever of 103, and all night I tried to help him keep him breathing deeply to keep his oxygen levels up. By the morning he was tired and he was able to rest, not better, but not much worse. But his doctors didn't know what was wrong, what the cause of pneumonia was, whether it was viral, bacterial, or autoimmune. The doctors were baffled. I come from a family of doctors, both my parents, my sister, my grandfather, all doctors. My mother always says the most important thing is to have a diagnosis. Otherwise, you don't know how to accurately treat. And they didn't know. By then, I called Lawrence's sisters and his mother to let them know he was still sick, and they were very worried. Soon after Shabbos ended, my sister and brother-in-law, who live in Jersey, came the long trip to see him, and my mother-in-law booked a flight to arrive first thing in the morning. My daughter's son and close friend came to see him that night, and while he seemed somewhat okay, he definitely was having a harder time breathing. By Sunday morning, his breathing got increasingly worse. They gave him a breathing mask and whatever else they could do to increase his oxygen. I had quickly learned how to read the monitors, and I could see that the effort for him to breathe the same breaths became increasingly harder and harder. By then, I didn't let my youngest daughter return as I didn't want to scare her. My 21-year-old son was there most of the day. And if you ask him now, he will say it is undoubtedly by far the worst day of his life. By then, the doctors were increasingly concerned. They didn't know what was wrong. There were several doctors asking several questions, but they didn't know much. My mother, who was a physician, felt compelled to come. She was very upset that they didn't know what was wrong. That's when I had gone home to shower. My mother came to the hospital and looked at the x-ray. I'm told her face shared it all. She was horrified. She had my son call me right away and said I must come back immediately. I came right back and she said, these doctors are in over their heads. He needs better care. This is viral and everyone must get their things out now, must be in masks now and keep their hands clean. You must move him. Meanwhile, the critical care doctor came over to us, my brother-in-law, sister-in-law, my son, me, and my mother-in-law, and said to us, take all measures that you need to take. I don't think he's going to make it. He's very ill. And I think he has something that either you don't recover from, and if you do, you are never okay ever again. This was probably the most monumental moment in this whole story. The doctor was not unkind, but he was not thinking clearly, I have to assume. He should never have said that to all those people, but most importantly, not to my son. A 21-year-old should not have been the one to hear it. My son was calm then and remained calm throughout those weeks of this ordeal. He cared for his sister when I could not, and in a way that was so sensitive and supportive, you would never have known how much he suffered from that day. But I remained positive. There isn't necessarily logic to it, but I felt I will take care of this. I will get him to the best doctors, and he is a fighter. This is not going to happen. I'm a realist, but I'm ever an optimist. And I told Lawrence's mom and my son, we're just going to get him better care. What the doctor said was a supposition, a thought, not a diagnosis. Just because the doctor said what it might be doesn't make it so. So we called anyone who could help us, and we got my husband a spot in the Columbia Presbyterian ICU. And then we waited and waited for the spot to become available. My husband worsened and fought to breathe more and more. He was suffering and felt like he was drowning. I can't imagine how he must have felt. Finally, as we waited, I told the doctors, I don't see how he can travel in an ambulance in this state. He cannot keep his oxygen up, and I don't want them to have to do something on the road. It was clear to me at that point they were going to have to intubate him. Not that I fully understood what that all meant then, but I knew he couldn't stay as he was. So that was when they put him in a medically induced coma. And at around 1 a.m., they took him to Columbia. I need to point out that throughout, family and friends came by and offered to stay with me and Lawrence so that we were not alone. I cannot tell you what a difference that it makes, just knowing others are there for you. I share this because it's an important lesson for us to be there for each other and let others be there for you. It is healing for those who give and those who are given. Once he was at the Columbia ICU, we never again were allowed near him. He was put in isolation where we could look at him only through a glass door. For the next 24 hours, he was stable, and the doctors worked at figuring out what was wrong. They didn't tell me that they tested for corona, but they did. By 9 p.m. on the next night, Monday night, March 2nd, I was asked to come to a room, and I was told he was diagnosed with coronavirus. No one had really mentioned that as a possibility before, though there was discussion that he had a contagious disease. My mother suspected it, but hadn't said it. The doctor basically said, your husband has corona, and all of you, and anyone with you, all have to leave the hospital immediately. They gave me the number for the Department of Health and said, we have no idea what to tell you, but you have to go home and not leave. My friend, sister-in-law, and brother-in-law who were with me all went straight home, and I spoke to the Department of Health to get instructions as what to do next. But they had nothing to tell me. They had no idea how it spreads, what precautions to take. They had no idea how widespread it was. Absolutely nothing. When I came home, I told my mother-in-law, my other sister-in-law who had just arrived from Florida, as well as my son Leon, that Lawrence was diagnosed with coronavirus. As for my 15-year-old, I only told her that daddy has a virus and that she also may have it and she cannot go to school tomorrow. All she heard was that she didn't have to go to school, and so she went to sleep. While it was a lot to take in at the time, I knew this was a big deal, not just for my family, but for everyone else. I understood this was huge, and we were going to be part of a big hoopla about this. But that night, I focused on making my kids, my mother-in-law and sister-in-law who were in my house, the ones who were with me, feel safe and secure. I then had to share what I could with the health departments to make sure no one else got sick. The problem was that while I could share our whereabouts, no one could offer us any other guidance. All we knew is that we should stay home. Liab, who had been with Lawrence, said he wasn't feeling great and was worried that he had it too, and fearful that he would infect his grandmother, aunt, or the rest of us, went to his room and wouldn't come out. He stayed in his room for several days. We brought him food to his door. The only time he came out that week was to get tested. My mother-in-law and sister-in-law were with us when we were quarantined and couldn't return to Florida. They ended up being with us for 3 months. They are both very warm and loving, which was a very helpful presence for all of us. In the meanwhile, I had 2 children abroad, my 23-year-old Ella and my 19-year-old Jonah. Ella was in Israel and Jonah had gone with his yeshiva on a tour to Poland. I did tell them that their father was sick, but it was hard to tell them how sick he was and what was really happening because I didn't really know. And also I didn't want them to panic. I was trying to decide whether to bring them home, what was best. The night after Lawrence got moved to Colombia, when he was in a coma, I decided they needed to be home. But Jonah was in Poland with bad Wi-Fi and was hard to talk to him. I didn't think Ella should be on a flight home alone. That would be too hard for her. So knowing that Jonah was returning to Israel that night, I had Ella book flights to come home upon Jonah's arrival in the Tel Aviv airport. Jonah flew from Poland, arrived in Ben Gurion Airport, and went straight with his sister onto a flight to New York. They will tell you they felt they had no idea what was going on. They had no idea if they were coming to see their father or to a funeral. They will say they knew nothing. From my perspective, I told them exactly what I knew, that their father had pneumonia. We didn't know the cause, that he was being moved to Colombia for better care, and he was on a ventilator. At that point, when I told them to come home, we had no diagnosis. I told them then, as I told all my kids time and again, that daddy's lungs are sick. And so there is a machine doing the work for his lungs while they cannot. His lungs needed time to rest and get better, so the machine is doing their work in the meantime. All his other organs are working. He is strong and would fight hard as can be to be there for you, so we must stay positive. We must have faith in daddy's strength, in great medical care, and God who is with us. We are a family, and we together are strong, and together we will get through this, which is why they should come home. I added that when daddy wakes up, I'm sure all he'll want to see are his children. Months later, as a family, we have discussed this, and I've individually discussed with each of my kids how they felt at this time. Some feel I wasn't there enough for them or forthright enough with them. I think they didn't realize how much uncertainty I had, or maybe I don't realize that realistically for me, I was not willing to consider how dire it was at the time. Or maybe they were going to hear what they were going to hear, whatever I said. Nevertheless, I apologize to them for not being what they needed at that time. I'm not sure I did something wrong, but I'm equally not sure that what I did was right. It was traumatic, something you would always want to shield your children from, but I could not because that's what the situation was. And as if that wasn't enough for them, I had gotten the diagnosis of corona while Ella and Jonah were on the plane, and now they could not come home, and I had to find somewhere for them to go and somehow explain to them over the phone about the diagnosis. I also knew if they spoke up about it loudly in the airport, they could cause mass hysteria. So as soon as they arrived, I called Ella and said to listen carefully and not to react at all, because if she did, she would not be able to get out of the airport. I said that daddy was diagnosed with corona. She had to tell her brother, but quietly, without his reacting either. I needed to tell them then because my parents were picking them up, and I was worried about whether either my mother had it as she had been at the hospital, or if the kids had it since they had been with me the week before. At that time, I had no idea if Lawrence had it before I went to Israel, or if I had it too when I was in Israel, and if so, for certain, Ella would have gotten it from me. With no guidance from the health department or anyone, I knew I had to keep everyone apart because I knew if Lawrence hadn't been anywhere and had gotten it, we all could have gotten it just the same. So I told Ella that she is not to hug or kiss her grandparents, stay away from them as best they can, and to open the windows. Bear in mind, it was the middle of March then, and the idea of keeping windows open for ventilation wasn't even a notion. I didn't know where to send them, but they kept saying to me that they wanted to be close by, not far from us. It occurred to me that my friends down the road had a separate guest house that maybe they could offer my kids. So at 5 a.m., I called my friend, told him that Lawrence had corona and that I needed somewhere for my kids to stay. Quite a lot to take in at that early hour. As I was discussing with them, my kids pulled up to my street, and I texted them that they cannot go anywhere, to stay in the car as I was working this out still. My friend said yes, they could stay as long as they didn't go near anyone. Ironically, in the end, my children, Ella and Jonah, never got corona, but those neighbors and much of my community already had it by then. So Ella and Jonah were holed up in a guest house for 2 weeks after having been away from home and could not come near us, kiss us, or even take anything, including their clothing, from our house. At the same time, I was on the phone with the Jerusalem Department of Health explaining all my whereabouts, which, as many of you know, were published all over Israel. I didn't realize it at the time, but while I was doing that, my son Liav, who studies at YU, also was sharing his whereabouts with his school and the Department of Health. While I was on the phone with DOH still early in the morning, the principal of Eva's school had heard about it from friends of mine who had been to the hospital and who were teachers who realized they could not go to school. By 6:30 a.m., he called me and asked me to confirm that Lawrence had corona, and I told him he did. The principal decided to close school. The others in the area followed. Eva woke up and read that her school was closed, and she immediately realized it was she who closed the school. Her classmates immediately were all over group chats talking about her. Meanwhile, my friend who had driven Lawrence to the doctor and hospital and had assumed that likely she had already been exposed, she very kindly came over to help our family. We hurriedly disinfected the house. We changed the sheets, scrubbed the walls, the banisters, the kitchen, everything. Soon thereafter, the DOH called me to tell me that the media was on the way to my house. They had heard about Lawrence. It was a big deal. He was a relatively young person, healthy, with no contact with Asia or China, who now became gravely ill. It was the first time we all realized that this horrid virus was likely amongst all of us. The first thing I did was speak to my children and tell them that they have each other and they need to speak to one another only. Ignore group chats and what is being said outside, but be there for each other. Second, I, my friend, and my sister-in-law covered all the windows in my house with tablecloths so the media could not see us. We wanted our privacy. It was all already very overwhelming and surreal that our husband and father was so gravely ill, but now there was a media frenzy outside on top of it. So what do you do? It was very important to me to stay calm. I was very aware that I had to do so that my children could feel calm. Secondly, luckily, Lawrence is extremely family-oriented. He works very hard, that we always all spend a lot of time together as a family, and that the kids spend a lot of time with each other. He regularly reminds them that they should rely on each other and assist each other. That is what family is for. They're all very close with each other. And so I reminded them then that this is the time they need to rely on each other, that it will be okay no matter what, that Daddy's going to be okay as he is in good hands. He is a fighter and will not leave us, and that we need to remain positive. We cannot let ourselves go down the road of negativity. I am a true believer that having positive thoughts brings out positive outcomes. Of course, it's not always true. And of course, then I was not certain of anything. But I did then, and I still now believe that positive energy is what was needed at that point in time. We didn't know what was going to happen and how long this would go on for. So we needed to be calm and supportive of each other. I also asked them to turn off social media, ignore the internet, and didn't allow the TV to be turned on. I wanted to, as best as possible, control the environment. I thought that keeping tranquil surroundings felt like we had some control of what was going on around us, and that would be helpful to us. I reminded them all that matters is that their father gets better. Whatever else is being said about us or him has nothing to do with us. Other than sharing what we could to prevent further spread, our job now was to stay focused on taking care of each other and taking care of our father. So for days, our windows were covered and Lawrence remained neither worse nor better, and we waited. On March 3rd, the day after Lawrence's diagnosis, all 5 of us in the house were tested. Ella and Jonah were tested at the place where they were, and no one could leave the house. And in retrospect, I learned that it was for the good, as there were reporters camped outside our house and I had tried to speak to every neighbor. Ella and Jonah, who were down the road, fared worse in many ways. They didn't have their things other than what was quickly packed, as they had assumed they would have their things when they arrived home. They had nothing clean to wear, and they weren't allowed to get anything from our house. They could not come to see us other than from afar in the backyard to say hi. Food delivery was hard because our whole area had become a containment zone, and they were alone but for each other. I, Liav, and Eva all tested positive. So did my friend. My mother-in-law, sister-in-law, Ella, and Jonah all were negative. Liav heard that he was positive from a Yeshiva University press notice. No one had called us first. None of us could get clearance to go to the hospital. No one could go to Lawrence to see him, to check on him at all. In those days, there was a lot of waiting to hear about Lawrence. I lived by phone updates a few times a day, and they would report his oxygen settings. It was stable, but no change. On the 5th day, thinking that this is like a flu, the doctor said they would start to awaken him. Having lost track of time, I didn't realize that it was Friday and that Shabbos was starting at 5. I would say that is the first time I lost some of my calm. How could he be awake without any of us there, all alone? I wasn't sure he could survive that. I had been trying to get someone to see him all week, and no one was allowed. Finally, after long calls to Cuomo's office, I was able to speak to the health commissioner and convince him that Ella and Jonah had been kept away from everyone in my community, tested negative, and had been in seclusion from us this whole time. He couldn't believe that I had thought to quarantine them separately, and I was so happy I had thought to do so, since it now allowed them to go to the hospital. I had asked them to be ready and packed to run to the hospital, hoping to get the okay to do so. I had a room in the Beaker Holm apartment waiting for them, and I was so happy when I heard that they could be there to get to Lawrence. In the end, while with all good intentions, in retrospect, it was a very traumatizing event for Ella and Jonah. Lawrence did not wake up then, and worst of it all, he was agitated, and they saw it. And equally as bad, by then the stigma of corona was pervasive. The ignorant ones of Columbia staff yelled at my children and told them that their father was the cause of this, and that because of him, they were understaffed or somehow the cause of the spread of this disease. And while my kids were supposed to be able to see him often, security complained that they didn't want to escort them and refused to take them to Lawrence more than one time. Most of the 25 hours of Shabbos, they were alone in a strange place, having seen their father in a medically induced coma, thrashing. To say that it was a very hard day for them is an understatement. And I don't believe Jonah ever entered the building again. He would stay in the car when Ella went in alone. As a mother, to have to ask your children to do something that which you yourself should be doing is so hard, but then finding out that it was even harder or more than anticipated was excruciating. But I hope I've conveyed to them how thankful I was that they did what I could not do. But truthfully, I was also stern with them. I felt that all eyes were on them and that how they carried themselves was going to be noted. I was very clear that they were not to lose their cool or scream or yell, even if they were justified. They had to control themselves and keep it together when they were there. They could scream and cry at home, but no one in that hospital should see bad behavior of my children. I know that was extremely hard for them, especially Ella, who was very emotional and who felt that my husband would fight to see any one of us. And I cannot say if I was right or wrong, but in my mind, keeping control and an experience that was so out of control in so many ways was a way to get through this. Another long week passed. Perm came and went with no shul, no shalach mano, and only private Megillah reading in our house. Ella and Jonas were still alone where they were. Meanwhile, so many others in our community became sick, and all New Rochelle had joined our lockdown. Our family's world was surreal, and by then, so was the rest of our communities. At the same time, many things were being said about us, about Lawrence, and there was negative attention that somehow he caused or spread this. He has no idea where he got it from. He went to and from work on a train to Manhattan. He went to shul for Shabbos, for a funeral, for a bar mitzvah. I don't think we will ever know how he got this. He had no underlying conditions or anything that would make him more susceptible to get so much sicker than anyone else, except one thing. He was stressed and run down. He wasn't sleeping. When you ask him now, in retrospect, he'll say, the lights were flashing red for me. I should have recognized it and taken a break. I didn't realize how stressed I was and how badly it was affecting me. After 13 days in a coma, he awakened on a Friday afternoon. He had gone to sleep to what used to be a normal world and woke up to a world of masks and quarantines and no shul. He took it all in day by day and began to understand. And all he wanted was to see us. He saw us on FaceTime, but we could not see him in person. After a month in the hospital, he was discharged to rehab. We got to see him once as we met his ambulance at the entrance to the rehab as he went in. He was determined to be home by Pesach, so a week later, I surprised my family and brought him home. We were also thrilled, but he was weak and needed much help walking and moving. He needed a lot of rest, but he stayed up to the end of each Seder. He was absolutely determined to. While he was thrilled to be home and alive, he doesn't want his children to see him as weak. And I tell him, and I believe my children would agree, that his being here only proves that he is anything but, that he is a fighter with Herculean strength. He is a success story. He is the man who beat Corona, when no one knew how to treat it. So it is now 8 months since he has been home. It has been 9 months that we as a family have been fighting COVID. In so many ways, we see only gratefulness for the amazing outpouring of support, gratitude to God for Lawrence still being with us. But then there is, like for all of you, this pandemic that lingers on. There is this constant pull over all of us. We are constrained. We cannot go out. And when we do, we have to cover up and disinfect. We and our children have little social interaction. We're all spending a lot more time with our family. In that way, my family is no different. We worry about our children being disconnected and alone, and since they cannot get together with friends as they used to. We worry, can our kids really learn on Zoom or with masks or in the cold outdoors? I worry about my 20-year-olds being able to socialize, to move forward in life, career-wise or socially, when they cannot meet up with people freely. And people rightly say they have had enough, because we've all had enough. Something I can say is true for my family in particular. It has been a rough year. In my house, we try to discuss it openly, that each of us should tell how they are really feeling. One kid was very happy we did this. And one kid said, "It's over. Why do we have to discuss it?" And honestly, until as early as last week, I would say life has gone back to normal for the most part in my house. It is true that Lawrence still has neuropathy in one leg. And it is true that we still work fully remotely, but the family is more or less as we had been before. But is that true? At first I thought so, but it is in the small things that you realize it is not true. This past weekend, my husband was taking the dry cleaning into the house and with a slight cough called out and said, "I need help." A normal occurrence of a dad asking his kid to help him with something. But that's not what my child heard. He heard, "Help, help, I cannot breathe." It brought back his worries of those first days of Lawrence being gravely ill. One child, who seems to be cheery and happy and truly okay from the experience, seems to be more of a homebody than ever, wants random hugs throughout the day. And then I thought about it. For weeks in March, no one hugged anyone at all. I didn't touch my mother-in-law and sister-in-law or go near them for the 3 months they were in my house. The first time was the day they left back to Florida in June. My kids who tend to be anxious are more so now, and the ones who are never anxious at all, including myself, express feeling it now, though they never had before. If you ask each child, each will express in some way that he or she endured the worst of it, having experienced something the others had not. Each one has their story and how it affected them, and they are all correct. Each one has suffered a trauma in some way. So now I am trying to be sensitive to hear what they need next. I realize now more than ever to assume that they are just fine or that it's over for them is foolish. This will take a while and maybe a lifetime to work out for themselves. But I think knowing that they have each other and the parents who love them so much, I think is priceless, or I'd like to think it is. So what do we do? What I have learned from this experience is that there is always good in what seems bad. Our lives have changed a lot, but I imagine for many of us, it is for the better in some way. We get to spend more meaningful time with our spouses, our kids. We spend less time commuting. We have reconnected with people in some way as we are all in this together. We are kinder to each other, and we need so much less. Lavish affairs, fancy dresses, pedicures, and manicures are all things we enjoy, but we see that we can live without so much of it and still have a rewarding life. Our lives have slowed down in many ways, and that slower pace has made me and Lawrence feel so much less stressed. We go out and enjoy the leaves falling and the birds chirping, things that before we were too busy to stop and enjoy. And for those with young children, I think so many kids are so happy that they can see their parents so much more than before. Having parents home, even if they're busy at work, is likely a secure feeling for children. And I'm sure each of us has found our own silver lining. In the end, what has helped me get through this experience, and hopefully the rest of this everlasting pandemic, is continuing to find the positive despite the negative. While it seems like it will go on forever, this too shall pass. We just have to hang in a little longer together. Thank you for listening to our story, and I hope you can find in it a way for you to see your pandemic story also as one with a good ending. Thank you.
Adina, I have about 100 comments I'd like to make, but I'm just going to make 2 for the moment. As before I introduce Dr. Blumenthal, and following Dr. Blumenthal, a number of questions that people submitted before tonight and are submitting now. My 2 comments are, You said, I was writing as you were speaking, I'm not sure I did something wrong. I'm not sure I did everything right. March 2nd, March 2nd, Lawrence was in the hospital. March 2nd, when the Jewish community was celebrating Purim, wherever they were, at home, with family, with friends, wherever they were, you were with Lawrence in a very different place. The two words that have been used most often in 2020 is essential people, essential workers, and heroes. If Lawrence Garbuz was patient number one, then Adina Lewis Garbuz was hero number one. My second comment. You said that the most monumental moment in the whole story, the words by the doctor, well-meaning but devastating. What the doctor said might be, but doesn't mean it's so. I was thinking about all the people, not only since March and COVID and currently and in the future, that are in the hospital or go to doctors for so many reasons. And with all respect to doctors and the entire medical community, and your family are full of doctors, it doesn't mean that the doctor says it, that it's so. And you have to ask questions, whether it's a second opinion or your mother who's a doctor or anyone else. I found it so important that you said, you have to push back. You have to ask questions. Don't be afraid. We have many more comments. I wanted to repeat those two thoughts that you had. I want to remind everyone, please, what we said at the outset of this conversation, that this entire conversation is off the record. Even though it's on Zoom and there are many people listening, we're asking that especially anyone that's representing media that is listening should not and cannot quote or report anything that's being said this evening without the expressed permission of Adina Lewis Garbuz or OHEL. Thank you very much, Adina.
Thank you.
Dr. N Blumenthal is OHEL's Director of Trauma and Bereavement, the ZACTA Chair of Trauma. Dr. Blumenthal has a private practice, a clinical psychologist with a private practice in Cedarhurst, New York. He has literally spoken to tens of thousands of people in these conversations, as well as private conversations on trauma and bereavement. Adina spoke about the stigma, the trauma of COVID. At the same time, she was so public about it, making sure that everyone can learn from their experiences. With that, it is my pleasure to introduce a colleague, Dr. N Blumenthal.
Thank you very much, David. And though I may be an expert on trauma today, I learned about a new trauma, which is to have to speak after a remarkable presentation like this. I feel like anything I'm going to say right now will be like the thud of a curtain coming down after a virtuoso performance. I'm in awe of you, Adina. I'm in awe of your family. And I thank you for the courage to share. There's nothing I can say that will let all come close to the contribution and to the growth that I think all of us experience as we listen to you. I want to just cull, we only have a few minutes left, and I want to just cull some of the comments. Maybe I'm a little bit, for those who know can reference this, I'm Rashi to the text here, and try to maybe just put a clinical frame on what was personally described. And again, what's personally described is far more poignant. There are a few themes, and I'm just going to focus, I only have a few minutes, focus on some of them, but I think that came across very effectively from this speech that you just heard. One of them, I think that I captured, and I think was laced throughout Adina's presentation, was the sort of spare of the moment decisions she had to make. How, without time to reflect or consult, how she had to decide what to say to children, who to call, how to deal with physicians, Department of Health. There was every 3 minutes in the presentation some kind of decision that had to be made hands-on, with no precedent and with no one even to discuss or consider or brainstorm. And while Adina very humbly questioned whether she made the right decisions or she made the wrong decisions, I think any of us listening know that if they weren't all right, it was overwhelmingly right. It was, if there was a grade, it certainly would be somewhere between 90 and 100. And I think that speaks to what happens to people during trauma. And this was obviously a prolonged trauma. We learn about an adrenaline rush that happens to people when they're physically threatened. If somebody's in physical danger, that suddenly the blood rushes to the extremities, and people have strengths and even stamina that they wouldn't have otherwise to protect themselves. There is something what I call the psychological adrenaline rush, that when people are in traumatic situations, the blood rushes to the brain, and there's like a hyper focus, and people are brilliant with regard to their situation. In fact, there's a misnomer out there that people in the throes of a crisis are not thinking straight, are somehow absent-minded, and it's quite the opposite. They may not be thinking about matters that are not relevant to the immediate crisis. They may not remember their aunt's new recipe for Lakshmankukul that they just heard about the week before. But when it comes to their situation, they really know what to do. And I think we can see this example. And if we are ever at the helping end, or if we are ever in a position where we need to assist someone going through a crisis, we have to remember this, that the person going through it is a genius for their situation. And we have to listen to them and value their point of view. And we heard that was replete in the presentation that was given. The other, I think, leitmotif that was evident throughout Adina's remarkable speech was how important family and community are. And again, I want to remind everybody that the family and community were not so important because they told her to do something that she hadn't thought about, or because of the advice that they gave, perhaps the one exception of her mother recognizing the severity of the illness. But for the most part, it was just their sheer presence. It was just the connection and the bonding that took place between family members and community. And this is so important, and a theme that we are emphasizing again and again during this crisis that we're going through, that just being together, just being in each other's presence is what helps in crises like that. It's not having to give advice. And sometimes people are so desperate to try to solve someone's problem that they give advice that's ill-conceived. But at no point, except maybe that one exception, was that significant presence of family members and community members useful because of the advice they give, just the sheer presence. And it raises the obvious question, what does that do? And we're telling people this all the time as advising people during this crisis, just be there. And I have to even tell you, as the one who people are calling during a crisis, very rarely am I telling them what to do. I'm just listening and I'm just attentive, and they feel helped. What happens? I've quoted a study probably countless times, and probably most of you have heard the study, but I'll repeat it because it bears repeating. The famous study where they took college freshmen to a very steep hill, gave them a heavy backpack, and told them to climb the hill. But before climbing the hill, to estimate how difficult it was to climb the hill. The only difference being one group climbed it alone and the other one climbed it with a friend. And consistently, the people who climbed the hill with the friend rated it as less steep and less difficult than those who climbed alone. How does that work? Why does that happen? And I think there are many parts to that. I think part of it is that when you go through a trauma and a crisis, sometimes you think you're crazy, where in actuality it's the situation that's crazy, but you're not. But it's the famous Viktor Frankl line, an abnormal reaction to an abnormal situation is normal. And so you think you're losing your mind, but you're not. You're usually very effectively addressing and dealing and immersed in a crazy situation. And knowing that other people are going through it and other people have had comparable situations does reduce that sort of self-diagnosis of one being crazy. Also, there's safety in numbers, as I said, with the Hill study. And the other thing is also it takes away from that sort of like feeling persecuted and feeling like, why me? Why am I the only one? Why am I selected for this? But when you know other people are, you feel less sort of stigmatized and persecuted. But for whatever the reason is, it is clear and evident from this that nothing helps more than close family ties and loving each other and caring for each other. So many times Adina said, we have each other. How Lawrence emphasizes family. And we don't need social media. We don't need to talk to the media reporters outside. We're not in this alone. We're in this together. And when you feel like you're in this together, the most insurmountable problems seem more manageable. And I think really, again, I see our time is almost up. And we do want to address some questions. So I'm going to conclude with one other piece that I think is so important and lessons. One of the many lessons I could speak on for so much longer, but there was so much to learn from this. But one other important lesson that we can learn from the Garbuz family in general, and was alluded to very effectively by Adina, which is these are life-altering events, certainly for a family like hers, who are so profoundly affected it is, and good even for those of us who may have been less profoundly affected. We're all being affected. The whole world, the whole globe is being affected. And this is life-altering, and we're going to change. But I think what we saw in this story, and I think this is going to be true for us, is that there's adherence and change. Yes, we're not going to be the same people. Our children are not going to be the same. We're not going to be the same. We're going to emerge from this when this is over, and this will have a beginning, middle, and end. But we're not going to just forget it, and we're not going to be the same people we were before. But we're not radically changed either. As we go through a threat like this, and as we go through these difficult times, we cling to what works. We cling to what we value, and we cling to what keeps us stable. And those are our family, our friends, our community, and our spiritual adherence and our belief in God. And God for whom there is a greater good, that where everything that happens, even if it seems senseless and painful, is directing us and leading us in the direction of some greater good. So there's both a holding on and a changing that was inherent and implicit in this presentation. As I said, there's treasures in this. And I think hopefully we should all not only take it from with us, but like they tell us to, like we do taught in yeshiva, to review Gemaras, we should review it and listen to it again and again and take so many of the timeless lessons from this. And again, I thank Adina, and please thank Lawrence for allowing you to do this, and also making himself vulnerable by exposing it, and let him know that this wasn't just an exercise in idle curiosity. We're not the media. We're not just looking for headlines. We're all here to learn and to grow, and I think we have.
Thank you.
Thank you very much, Dr. Blumenthal. Thank you. I'd like to spend just a few brief minutes asking Adina and Norman some questions. Adina, you spoke about, in effect, the silver linings of COVID. You said there's always good in what seems bad. You've been able to spend more meaningful time with family, kinder to each other, and we've learned to live with less. So these are comments that you're able to make looking back. A question was posed about the present. There are many people that are going through COVID, or unfortunately may go through it. The question is, if a friend is going through a similar crisis now and called you for help, what are the most important bits of advice you would share with that friend about going through COVID right now?
So thank you for the question. So actually, as this went on, because somehow I was a little more public than other people who had been going through the same experience, I had actually been reached out to by many people who were going through this at the same time. A lot of women whose husbands were on ventilators, and they felt terribly, terribly alone. And they reached out to me because they just didn't have anybody else who could relate. It felt very lonely. So again, as I said before, and I think the most important thing is to try to stay positive, and it makes sense to not to feel impending doom, because there was impending doom possibly. But I think that my thinking was, and I think that hopefully somebody can do the same, was that I know today, each day with Lawrence in a coma, for example, I said, today he was all right. He hasn't gotten worse. And the next day, if he stays the same, that's still good. And that hoping that I can only worry about what is now. If something worse happens, I'll worry about it then. But I can only deal with the present. And right now, the present is not great, but it's not worse. And I think trying to feel just hopeful is really the most important. And the other thing that I learned for me, and I would say to somebody else, learn how to take help. That was probably the hardest thing for me. I'm the one who brings food to somebody else. I'm the one who tries to fix things. I'm the one who tries to be involved and help somebody when they have something going on. And I remember somebody called and offered us to make Shabbos food. And I said, we don't need food. We can make our own food. And my son, who's smarter than I am, said to me, Mommy, people want to help. They don't know what to do. Let them help you. Let them make food for us. And I think that was very wise.
So Dr. Blumenthal, Adina said to stay positive and stay hopeful. How does one stay positive? You know, the media all day long, all you hear about is the number of COVID cases, the number of intubations, the number of hospitalizations, the number of deaths. How does one stay positive when the world around you feels gloomy and you really want to be hopeful, like Adina was describing?
So it's an excellent question, and it bears upon another sort of known fact about trauma, that trauma built upon trauma grows exponentially. I often say it's the math of trauma, that in trauma 2 + 2 doesn't equal 4, it equals 8. My mother, may she rest in peace, who was a very wise Holocaust survivor, used to use a Yiddish saying, which I won't try to repeat in Yiddish out of respect for the language, but it was something to the effect that when a poor man has a hernia, there's a pimple on it. So it is hard. Hope is a tricky place. It's very easy to say, oh, I'm be hopeful, but you can't be delusional either. Because if you're unrealistically hopeful, then you're setting yourself up sometimes for a crash that can be even more devastating. Hopeful means being hopeful within the rubric of what is possible. Sometimes also, and this is a piece of advice that we land up giving to a lot of people, sometimes the situation is so complex and there's so many different pieces and there's so many different eventualities that you almost have to purposely not see the whole picture, that you have to take pieces of the situation and visit them. It's almost sometimes visually what I propose to people is there's several doors in front of you, and you visit the door you need to visit at that moment. So if the door that you need to see at this moment is the hopeful one, visit the hopeful one. If the door you need to visit right now might be a little bit more of a realistic one, visit that one. But some situations are so big that you have to sort of bifurcate. You have to sort of cut it up into pieces and visit it in manageable portions.
I have a good friend who wrote me a note, a cancer survivor. She said that one of the regrets that she has as a cancer survivor is that so many of her friends offered to help her during her trauma, and she couldn't accept help. She didn't accept help. You know, she's a strong person. She says, looking back, I should have accepted help. Exactly what Adina said. Adina, OHEL does a lot of work with children of all ages, early intervention, school-based services, adolescents. We do a tremendous amount of work with children at OHEL. Could you comment? And maybe we'll conclude with this question. How did your children, you have 4 children, I think 15 to 23, you said?
Yes.
How did your friends' children react to them? How did they deal with the situation, especially that they were isolated?
So meaning how did their friends deal with them?
Yes.
So I think it was varied. I think that a lot of children and their reaction, I think a lot of adults felt this way too. You knew we were upset. They wanted to do something. And again, many people say this to me, even when I meet them now, they said, I was thinking of you the whole time, but I didn't know what to say, so I didn't reach out to you. If that's true about an adult, that much more so about a child or a young adult. And so I think that some of my children definitely had people who were close to them who probably just were silent and weren't there for them, not because they didn't care, but because they didn't know what to say. But on the other hand, many children and friends deluged my children, filled them. They sent hot cocoa and they sent popcorn, and they just were there for them because and in a way, maybe you don't know what to say, so send some hot cocoa. It did the job just the same. It meant I am thinking of you. And I give tremendous credit. I think the hardest was obviously for my youngest one, who I think, there were these group chats talking about her, and there was somebody saying, I sit next to her in school, oh my God, and that made her feel like this pariah. And but I also think that she was very appreciative of the people who did reach out to her, and I have to give credit to parents. And I've learned from this, and I tell my children the same. You can tell kids who didn't know what to say, their parents clearly gave them guidance and said to them, reach out to your friend and just say, I am here. Just say, I'm thinking of you. And I think that was a very good lesson that we should all learn from, and I learned from.
Adina Lewis Garbuz and Dr. Norman Blumenthal. First of all, Adina, I imagine that Lawrence is somewhere nearby, and we'd like to say hello to Lawrence. And
Lawrence,
also
you here?
to,
Yes.
also to thank Lawrence for his participation, volunteer as a board member of OHEL's Lifetime Care Foundation. And both of you, hi, Lawrence.
Hi, hello, everyone.
Everybody's very happy to see you, thank God.
Thank you. Thank God. Okay.
And we want to thank both of you, Adina and Lawrence, for your pro bono work on behalf of individuals with their disabilities, with trust and estates, and helping OHEL's Lifetime Care Foundation. Adina, thank you for a very courageous personal reflection. Our best wishes to you and Lawrence and your children.
Thank you.
Continued good health and strength for decades to come. Thank you very much. Thank you, Dr. Norman Blumenthal. Thank you all that arranged this evening. Thank you all for joining us, and everyone continue to stay healthy and safe. Good evening.
Thank you to all of you too.